So in 2014, I was the director of communicable disease control for the state of Illinois. And one major incident happened during that year. And from a public health perspective, it was a event that had the potential to impact everyone across the globe in a manner that we really weren't prepared for. And that incident was the start of the Ebola outbreak that had happened in Africa.
Welcome to the Powerhouse. My name is Joshua Gonzalez, but you can call me JG. This show is for the moment before the win, when you're at the crossroads and your judgment actually matters. Each episode, I sit down with a leader here in New York City to unpack one real decision under pressure. What the stakes were, what the trade offs they faced, what they chose, and the values behind it. Then we publish a short written breakdown in the Powerhouse newsletter on LinkedIn. So the lesson is easy to share, easy to remember, and useful long after the recording. So if you ever had to make a hard call with imperfect information, this is for you. Let's get it started. Our feature leader is a physician and public health professional. Please welcome Dr. Fred Echols. Welcome to the show.
Thank you. Thank you for having me.
So, this is a special episode because it's a Saturday, so we're working pretty early in the morning as well. So tell us, so where were you right before making this big decision?
So in 2014, I was the director of communicable disease control for the state of Illinois. And one major incident happened during that year. And from a public health perspective, it was a event that had the potential to impact everyone across the globe in a manner that we really weren't prepared for. And that incident was the start of the Ebola outbreak that had happened in Africa. And then with international travel being so accessible, I'm worrying about transmission not only abroad but in the United States. But the biggest concern was how will we prepare our most vulnerable populations to handle this event in the event that cases were transmitted in their community.
So fast forward to your decision. Tell us through the two real options in front of you. Like option A was this, and option B was this.
And so one of the things that I started to do in government was really look at how we operate and not just going through the day-to-day activities, but how are we engaging the communities that we were charged to serve. And one of the challenges that we had to navigate was breaking the status quo. So oftentimes with government, what we'll do is we'll say, this is what we have for you and this is how we give it to you. And that can be in the form of resources, it can be in the form of communication, prevention materials, et cetera. And so for this incident, because of the high mortality rate associated with Ebola, we really needed to make sure that everyone was really aware, not only people in lay persons in the community, but also healthcare professionals so that they could protect themselves in the event that they were exposed or had the potential to be exposed to someone who had become infected with the virus. So looking at how we were engaging our most vulnerable populations was really something that I took to heart. Not only because of that time, but also because of my experience growing up in Atlanta, Georgia, where I saw where the health systems and the public health infrastructure really failed those individuals who were most at risk for having chronic illnesses such as diabetes, heart disease, et cetera. But just in this case, it was a matter of a potential matter could be a matter of life and death for a lot of people for something that we really weren't prepared for. And so as we were developing materials for local health departments across the state, is we had to keep in mind the populations within their community. So we had to really look at closely at languages that were spoken by the immigrant populations. We also had to be mindful of individuals who had functional illiteracy because we saw that rise up again, become an issue during the COVID-19 pandemic. And so we had to make sure that the material that we were putting out for individuals or the guidance that we were issuing for individuals we had to make sure that that was accessible and that the majority of individuals within our state could comprehend it.
Got it. And what were you faced with that you had to make this decision?
Well, so as the director of communicable disease, all of that fell under my purview. And so working closely with the external affairs, public affairs, individuals within the organization, as well as working with other branches within the Illinois Department of Public Health infrastructure, such as the emergency preparedness groups. We had to really work together to make sure that the information that we were putting out was accurate, but also we had to make sure that the information, as I said before, to make sure that it could be comprehended by by the masses across the state.
Right. The way I understood this, you had an objective wherein you had to say things, announce things as a public health official very clearly, but at the same time mindful about the potential response of certain communities and making sure that you're able to address specific sectors or areas that are kind of going to be more affected. The way I see it.
Absolutely. Absolutely. Yeah, we definitely had to prioritize those communities that would be impacted the most. And so for in this case, the healthcare professionals were the ones who were deemed to have the highest risk because of their roles. And so there was a lot of engagement with the healthcare systems across the state as well to make sure that they were properly prepared. And so a lot of them invested millions and millions of dollars building ICU wings that could really keep them safe, as well as developing protocols for PPE that were necessary to also keep medical providers and healthcare professionals safe.
I see. And you had this mandate, you saw that there could be a big problem if this wasn't addressed. Take us, seems like I wasn't able to catch it. What was the options in front of you that you had to pick between?
Well, so the challenges were either we just maintain the status quo and we just issue whatever information we wanted to versus really engaging the communities
I
across the
see.
state to make sure that the information was tailored to them so in a way that they could receive it in a meaningful way.
I see. I see. Now I understand. So just make following the status quo. What was the trade off there? If you had to just follow this, let's take it one by one. What would it mean for those affected people if you just did what was the kind of the template for it?
So doing nothing or maintaining the status quo meant that more people could potentially be at risk for contracting Ebola. And we know again the high mortality rate, meaning that this could have been life and death for a lot of people. Luckily, in the state of Illinois, you have some very astute clinicians, particularly in the Chicago area and surrounding areas, and so a lot of them were thinking ahead. But for some of our more rural communities, that could have been really devastating for entire communities. And so we have to make sure that our actions would result in the best outcome for the majority of our constituents across the state.
I see. So it would have been essentially the scale and the potential damage as a whole would be much more severe. And for this plan B, when you had to kind of be more proactive and be more agile about your decision making, what was the trade off there? Was there a situation wherein maybe if you would it be in conflict with the current protocols at that time? What were you trying to avoid?
And so we're always mindful of any legislation or protocols that are currently in place. And what we have to be, one of the things that we also had to be mindful of is, we had to be, whether or not we were nimble enough or flexible enough to make adjustments as we were navigating the pandemic. That's something that's common whenever you have a pandemic or a virus of not necessarily unknown origin, but you don't know how it's going to behave in a particular environment. You have to exercise some flexibility, meaning that you adjust your protocols, adjust your policies to make sure, again, you're doing what's in the best interest of your population. And that's something that came up again during the COVID-19 pandemic. So we had protocols, well, we didn't have protocols in place specifically for COVID-19, but we had to look at how the virus was transmitted and use that information, scientific information, to adjust our protocols and develop protocols as we were kind of building the plane, if you will, over the course of the pandemic.
Oh, the COVID pandemic definitely memorable for the global population and of course the public health professionals that were kind of pushed in the front lines to make hard decisions like what you had to do during COVID pandemic. Did you also have to kind of become proactive as well, or was the lesson from the Ebola pandemic already enough at that time?
So the lessons from the Ebola pandemic were definitely in my back pocket. I pull on those lessons every now and then. But for the COVID-19 pandemic, I definitely used the lesson that I learned from the Ebola pandemic. But also, we had to make some new adjustments. So during the COVID-19 pandemic, I was the director of health for the city of St. Louis, and so in that role, really working directly with the mayor's office and the mayor's cabinet to educate them on not only transmission, but also educate them on the backdrop. What happened before the pandemic actually started? That's another really key factor when we are developing our response protocols and practices is understanding the lay of the land before disaster strikes. And so for the city of St. Louis, we knew that there was significant levels of disinvestment. There are higher rates of chronic illnesses such as chronic lung disease, heart disease, diabetes, etc. And so we had segments of our population that we knew were more likely to have severe outcomes in the event that they were infected. And we had data to prove that. So in public health, we collect data on a daily basis, and we analyze that data and we issue reports on that data. So we knew what the social vulnerabilities of the city were at the time, and we had to utilize that information to make the best decision. But because there's a hierarchy, right? So the mayor makes the final decision. So I had to utilize my platform to really educate the mayor on
Mhm.
why certain decisions needed to be made. For example, when we're looking at where we were going to place vaccine resources, the data showed us that we needed to place it in those areas that were had the highest burden of chronic illness. And initially they didn't really understand that, but after a while, when they made the decision, you saw, okay, when the death toll started creeping up, they understood why we needed to do it. And luckily, we made the decision early on to place resources in those areas. So while we did see the first 13 deaths were African American, we were able to mitigate that over the long haul and have some of the best health outcomes because of our community engagement, but also we utilize the data to guide a lot of our decision making.
I, I wanted to clarify on this thing where there's this specific way of handling disease. And of course, there are special cases like COVID where this is something new. Was there any risk that you're going to make a wrong decision and you'll get blamed? And what was on the line?
There's always a risk. So whether you're in the middle of a pandemic or if it's just your day-to-day operation and the health issues in your community. But what we have to do is at least the practice that I've adopted has been utilizing the data that's in front of us, and also looking at the available current scientific information to help guide our decision making as well. And that's really important because you need to be able to justify the decisions that you make. And also, if you're utilizing city resources, those are those equate to taxpayer dollars. So, how are we utilizing taxpayer dollars in a manner that's efficient and that's going to improve the long term and short term outcomes for our constituents? And so, being able to speak to that specifically is important. But also, as I mentioned before, being able to communicate in a way that's meaningful to the majority of the population is also important because, as many people know, there's a lot of distrust when it comes to government, whether that's at the
Mhm.
local, state, or federal level. And so being able to meet people where they are is really important. And so one of the things that we had to do is not only just issue guidance, but also go out and talk to people. And engage with people so that they can say, "Oh, they really do care about us." It's
Right.
not just a gimmick because there was a lot of misinformation and disinformation circulating across communities related to COVID-19 vaccines. And then even during the Ebola pandemic, there was misinformation that was circulating across the internet and across communities. So we have to do our very best to make sure, again, that we're meeting the people where they are, gaining their trust over the long term, and being able to meet them consistently. I think that's the other challenge with government, and particularly in the public health sector, is an issue will come up or funding opportunity will come up, and then the community sees us then. But then when those after that period passes, we're nowhere to be found. And so we have to make sure that we're engaging community consistently over the long term to maintain the trust that they've obtained for us.
Fine. So what made this making this big decision hard?
For me, the decision wasn't necessarily hard. The hard part was engaging with people. So for me, the work is usually not that difficult. It's how
Mm.
do you engage with other people who may not think along the same lines as you. And I think that's one of the things that the Obama Foundation really taught us a lot about during my fellowship with them in 2023 is being able to reach across the aisle and engage those individuals whose line of thinking may not be the same as yours. And how do you engage them in a way that is one that's meaningful, but it can lead to a good outcome, especially when lives are at stake. And so being able to have discussions with all the persons across the city of St. Louis, being able to have discussions with private businesses, business leaders across the city of St. Louis was really important. And the way that I decided to engage them was I would allow them to create work groups that would establish the standards for during the pandemic. And so that allowed them to have a significant level of investment, but also allow them to champion the mitigation measures that we were trying to promote as the public health department. And that led to some really great outcomes, not only in the public sector, but also in the private sector. And we were grateful for those partnerships that were able to sustain, not only during the course of the pandemic, but beyond.
You mentioned that the hard part here is not necessarily the work itself, but essentially people. For leaders, we lead people, and sometimes people have a misconception that leaders just kind of order stuff around and people are automatically going to follow and abide by everything. It's definitely hard when you're dealing with, especially multiple stakeholders. Which stakeholder for you is that you encounter the hardest in terms of communicating with them?
For me, the hardest, well, I think there are two. So
Okay.
one, um, in I think the laypersons who have been disenfranchised and neglected by city government for a long period of time, is really difficult to come to them with new ideas and new resources with them, and for them to just trust us at that point. And so being able to, again, engage them consistently over a longer period of time, and just so that they can see that it's not just about this project or this pandemic, we're really concerned about their health overall. That allowed us to gain their trust. The other group that we really have to be mindful of are the lawmakers. So the legislative branch of government in the
Mhm.
city of St. Louis. And that's because any type of issue can become a political issue. And so while we try to remove public politics from a lot of the health issues that we see, it's just difficult. And so being able to work with them and educate them, because a lot of them may not have any history in public health or
Background.
a significant background in public health or health related issues. And so being able to educate them is really important. And so in a lot of cases, the same strategy that I use for laypersons out in the community, I use for the legislative branch of government, because at the end of the day, we're charged to be educators, and how we educate them may shift differently based on the scenario, but overall, we're charged to be educated. And again, that's why it's important to create language and communication that can be comprehended by the majority of individuals. That way, you can use set language across the different populations, and then they can't say, "Oh, you said this one thing to one population, you said something else to us." And so, being able to create that standardized language is really important as well.
I saw this interesting tidbit during what you said. You have to be consistent, right, in terms of your communication. You can't say one thing to the other. Of course, they're going to talk to each other. And
Right.
that's a big leadership lesson. Can you take us through maybe a specific conversation, let's say with a layperson, and talk to me what made it hard? What were their concerns, and what happened then?
Hmm. I think one of the conversations that I had with the layperson was a business owner in the north part of the city of St. Louis. And so part of our strategy during the pandemic was to go out and canvas. So we actually went out into the neighborhood to pass out or distribute PPE, or personal protective equipment, which included a hand sanitizer, face masks, gloves, etc. And so one of the business owners I engaged, I went into her shop. She came out and she started talking about how no one had showed up for them. No one had, this has been years of disinvestment. And again, why should they trust us now during the pandemic? And so at that point, I just had to really inform her about why the issue was so important, that we had to be out and distribute resources, but I also had to make sure that she understood why this was a public health concern. Why was this issue so important that the federal government was providing billions of dollars of resources into our response? And after doing that, then she was able to see, okay, I understand the why now. And so then that enabled her to be able to go back into her network and be a champion for our public health response, which is really great.
I see. And of course, you had some iteration in speaking with the slave people. What did you learn quickly when you were kind of engaging with them?
Never underestimate the power of numbers. And I say that, the more people that you can educate and inform and empower through with knowledge, the more people that can actually live healthier lives in their own communities. And I think we miss the mark on that sometimes when we're creating different initiatives and not engaging the community at large. And so one of the things that I was really elated about was the having the opportunity to really engage and empower people, groups of people across the city of St. Louis and beyond, in a way that was allow them to go back and be champions for their own communities and their own households. Before we really missed the mark on that, and I think and that was a lesson I think that we hope every health department learned, but also hope that it was a lesson that they actually implemented beyond the COVID-19 pandemic. Because in our world, what we say is, okay, we had one pandemic back in 2020, but it's just a matter of time before we have the next.
And take us through an example of when you were having a conversation with a certain politician, and how did it go? Trying to explain to them this expertise of yours.
So that was some very difficult conversations. So I think one of the conversations that I had was around the availability of vaccines. So at the beginning of the pandemic, no one had vaccine,
Right.
and so we knew that vaccines were coming. We just didn't know when. And so unfortunately, we had uh, all the persons who thought that the vaccines were already in St. Louis, but it wasn't in their ward, and so we had to really one educate them, and even though educate them to the point where um, we really exhausted all options. We said we don't have any, but also kept them engaged as we were going through the process to secure vaccines through the state of Missouri for the COVID-19 pandemic, and that helped mitigate some of the challenges. But overall, I think it was so highly politicized that there were some other challenges that came out of that. But again, just keeping them in the loop. We worked to provide weekly updates. So the mayor provided a weekly update on Tuesdays and Thursdays towards the end of the pandemic. But at the beginning of the pandemic, we were having information sessions for the city of St. Louis through her YouTube channel almost on a daily basis. Again, we just wanted to make sure they were informed. They had access resources that we were securing for them. And then we also wanted to create a platform where they had specific questions about the COVID-19 vaccines, our response, the virus itself, and we were able to answer those.
So you mentioned you spoke about the vaccine, and there was essentially scarcity involved, wherein, of course, the manufacturing is slowly ramping up. This was experienced throughout the world, right? No one had and everyone had vaccines. It was procurement, buying, and stuff. What was the main concern of this government officials? Was it they wanted to do the best job ever, or it was trying to kind of become public facing and to look good while making hard decisions? What was making it hard for you to kind of get how do you say this, like, let's just say during communication, what was the hard factor there that you feel that they're facing?
I think one of the things was just on a community, at least for the city of St. Louis, was
Right.
not utilizing resources that were already in place. For example, there was a TV station that was owned by the city of St. Louis, but the health department hadn't utilized it in an effective manner. And so one of the things that decided to do with my public information officer, my PIOs, was to create a standardized engagement session where we could provide information to the community at large. And so a lot of those types of things were happening where we were just saying, okay, the city already has these resources. How can we best utilize them? The other thing that we wanted to do is make sure that the city had access to data related to the spread of the virus across communities. And so working with our GIS officers or geo information system officers that were based out of the IT office, working with them to create an online platform so people could see how communities were being impacted by the virus as well. And so we really wanted to create a lot of public facing resources for our community. But again, that was during the pandemic, but those types of activities really need to be standard across the year, prior to major health events. That way you don't have to feel like you're starting from scratch. You don't have to create new contracts and do all these things that are really time consuming, especially when you have antiquated processes within government, which can really slow down your progress and your response. And so, again, doing our own kind of assessment, identifying what resources were available, then maximizing our use of those resources to reach the individuals in our jurisdiction.
Right. You mentioned that it's about allocation of resources and making sure these are effective ways to kind of deploy resources. And then at this portion, the mayor was essentially the ultimate chief officer of course, area, and then the lawmakers were essentially legislation, and you were serving as a role of advising and making sure information is spread. What was there a risk that if you kind of overstep your aggressiveness in communication, was there like they could relegate you to a lower position, or they could really like move you to a different department? They don't want to. Was there that aspect of it?
I think that to an extent, I think, but one of the things that happens, so whenever there's a public health emergency such as a pandemic, the decision making authority is actually transferred to the director of health, and so
Mhm.
that's once after that's declared. And so at that point, it was me working with the law. Working with the mayor's office as well as working with the legal counsel to make sure that we were operating in the best interest of the community, but also working to make sure that the language that was drafted related to mitigation measures and new policies for the pandemic were sound and properly disseminated.
I see. And that kind of gives us the whole picture of what you were experiencing at that time, the pressure of literally non-politicized, like people are dying and people are losing jobs. And if they lose jobs, they might be more susceptible to going out and getting the disease, of course, being transmitted to them. In dealing with, let's say, government officials and people in power, what did you learn quickly during a crisis like this?
I think the quickest lesson I learned is um, never stop educating. And I think oftentimes we take for granted, the kind of the redundancy of the information we put out related to flu season year in and year out. That information is really important. I think oftentimes, again, we take it for granted, but those are opportunities for us to really do a more effective job of reaching individuals in time of peace, if you will. And those should be utilized to hone our skills, fine tune our skills, whether it's communications, community engagement, whether it's public speaking. Those are opportunities where we can really fine tune our skills as professionals so that when we do have a larger, a more disastrous event that impacts our community, we are better prepared than we would be. But I think we have to really be mindful about doing our very best and learning from each opportunity that we are afforded to engage with other people.
Hindsight 2020, looking back, uh, what do you think one of the most important rules that you learned in making tough decisions, and so our audience can potentially apply it next week right away, change their life and change the life of the people around them?
Changing democracy is possible, and I think when we think about democracy, we think about just having national impact, but we can impact democracy at the local level. And so, one of the things that I always tell people is that everyone has a role to play in shifting democracy, whether or not we choose to own our role. That's on us, but we have to. Everyone has a role to play, and so that's one thing that I learned specifically during both of the Ebola pandemic as well as the COVID-19 pandemic is when you empower people in a way that's meaningful, they will make they will make better choices. But we have to one, reduce the stigma associated with certain populations. There's a lot of, again, misinformation and disinformation that circulates around on the internet and just in communities from person to person, but creating good communication avenues so that individuals, one, would can trust the information, but also that they can use that information to empower their networks is really important. And to be consistent. We have to be consistent when we're engaging the populations that we're responsible for serving. Again, and whether that's a local, state, or federal level, we have to do our very best to make sure that we're operating in their best interest, but also communicating how we're doing that. I think that's how we obtain their trust and how we maintain their trust. When there are gaps in our communication, when there are gaps in our engagement, individuals are more likely to become distrustful. And so, as we often say in the political realm, is what have you done for me lately? And so we are
Mhm.
communicating on a regular basis and say, okay, they are engaging us, they're providing us with resources, and they can speak to that versus waiting until election time or waiting until the next major public health emergency happens. And so I think that's one thing that those are a couple of things that we really have to do a better job of.
Great. We had a previous discussion as well. I see. I think it would be relevant. You mentioned that making personal decisions based on the scientific method. How can you mentioned that? I think that's a good value to kind of give our audience, take them through how to make better decisions as well based on that concept.
Yeah, so when we first learned about the scientific method back in middle school, we didn't appreciate how it really standardized approach. Well, we appreciate how it standardized approaches for research and science, answering science questions, but it also can help us standardize our approach to other issues. And so, one of the things that I typically do is I utilize that same approach when I am faced with difficult challenges. And again, it just helps me standardize how I develop responses, develop resources, etc., to make sure that one, I'm doing my very best as an individual, and I'm upholding my end of the table. But it also helps me to identify what resources I don't have. So oftentimes, we don't have all the resources within our office or within our agency. And so understanding where the gaps are, then you can also identify who the proper stakeholders are that you need to bring to the table to help ensure a more efficient and effective response. And so utilizing the scientific method is really something similar to help standardize your approach is really important. And I think the other thing is it allows us to think more thoroughly. So oftentimes there's a lot of pressure, there's a lot of stress that comes with emergency situations. And when your cortisol is rising, you forget stuff. So it's really important to have a process in place that allows you to think clearly and to think thoroughly, so that you can provide the most comprehensive and effective response possible.
I love how you mentioned it, but a lot of people kind of forget what they learned in middle school. Maybe just take us through like a high level view of how to think like that and how to potentially apply it in something day to day.
So for day to day, I think, well, for me, what I eat, so I'm vegan. So thinking about what's the challenges, I need food. Okay, what kind of food is available? Is there vegan food? Is there vegan options available? If not, what are there other resources that I can tap into to obtain vegan options? So, and then that question, okay, we have DoorDash, we have Uber Eats, we have all these other options so someone can bring food to me. But then are they delivering in the area is another question that I have to raise. So kind of going down that pipeline, but then also looking, okay, what's the turnaround time for me getting food? Is it going to be before my next meeting? Is it going to be too late? Having to pull pull all those questions, pull all those factors together to get to a final decision. Um, Luckily, I don't have to think that in depth about food every day, but that's just an example of how we can use a standardized method to um, uh, for something doing our daily activities.
That Thank you for kind of taking us through that. At least people have a way to, because this is my first conversation that I wanted some of our listeners to understand. Like sometimes we make decisions based on our heart and our gut, right? But also there are decisions that we have to kind of think more analytically about. The critical thinking is a key skill right now that might be missing in a lot of people. Not for the lack of trying. Sometimes they just don't know how to think about it, and using the scientific method to check assumptions and making sure that they're making the best decision, not just for themselves, but for people around them.
I think you bring up a really good point. So with the utilization of AI, I think
Mhm.
we're losing that capacity, and so people are relying on machines and algorithms to make decisions for them. But sometimes those algorithms can't take into account some of the nuances that we experience as individuals, like living in the world. And so it's really important for individuals to not lose that skill set, again, because AI can't do everything for us.
Perfect. Enjoy this conversation, Dr. Fred. Unfortunately, we are in the final stages of this conversation. Please tell our audience who should reach out to you. And at the same time, how should they reach out? And then lastly, what would be your final remarks to our listeners?
So individuals who are interested in reaching out to me, they can reach out to me via LinkedIn, other social media outlets such as Instagram and Facebook, and then they can also email me directly at fredrick.echols@gmail.com. Individuals that I typically work with are individuals who are interested in advancing population health initiatives, particularly working with governments and community-based organizations to leverage existing infrastructure to better support our most vulnerable communities. And the messages I have for the audience is everyone has a role in shaping democracy. And so, defining what your role will be is something that you have to figure out. Defining what you want your legacy to be is something that we all have to figure out. But at the end of the day, we all have a role to play.
If you're serious about making better decisions in your life, career, or business, subscribe to the Powerhouse. Every episode, we unpack one real decision under pressure so you can learn from leaders across New York City. And if there's someone whose story we should feature next, drop their name in the comments. I'm JG, and I'll see you in the next episode.